What happens when you go to a memory clinic? How do doctors diagnose dementia? The first indications of possible dementia can be problems with memory, but there are also other signs such as being depressed, finding socializing with friends and family more difficult, struggling with daily activities, or having changes in behavior or language. All of these changes can be caused by problems other than dementia, and getting the diagnosis right can be difficult. Only about 2/3 of people living with dementia have been diagnosed, and it typically takes about 3 years to get a diagnosis from when people first have symptoms. Unfortunately, the current process of diagnosing dementia is not completely fair. People who are Black or South Asian wait longer on average for a diagnosis than white people do. This needs to change so that everyone can benefit from our health service. Getting a diagnosis usually starts with being referred to a memory clinic. A doctor or a nurse from the memory clinic will speak to the person and their family to establish exactly what their symptoms are, how long they have been going on, and whether they have other medical problems that might explain their symptoms. Usually, this conversation will be followed by some test of how well the person is able to think. For example, they may be asked to remember some words, name some objects, or copy a picture. This allows the doctor in the memory clinic to see exactly what types of thinking are affected and how serious the difficulties might be. Unfortunately, these tests are mostly designed for people who speak English as their first language. People might lose points on tests like this simply because they speak English less well or because they left school at a younger age. This is one reason why people from certain backgrounds face difficulties getting a diagnosis. Brain scans are an important part of the assessment in a memory clinic. They can show whether parts of the brain have shrunk and whether there has been damage to the brain from not having enough blood flow. MRI scans are the best because they provide the most detailed pictures of the brain. However, some memory clinics mainly use CT scans because they are cheaper and quicker. And this may be another reason for unequal access to an accurate diagnosis. Doctors in the memory clinic look at all the information from the patient, their thinking test, and the brain scan to decide whether they have a dementia, such as Alzheimer's disease or something else. However, often it's impossible at this stage to say whether someone's symptoms are due to dementia or not. Patients often have to come back to the memory clinic after a year or two to be assessed again before they can be told whether or not they are suffering from dementia. Once someone has a final diagnosis, they can access treatment and support if they are suffering from dementia, and they can benefit from reassurance if they are not. There are some additional specialized tests that can tell more accurately whether someone has Alzheimer's disease. These require having a lumbar puncture where a needle is put into the patient's back to get some of the fluid from around the spinal cord, or a special scan called a PET scan that uses a radioactive dye. These tests are only available in about 1 in 20 member clinics in the UK, so most people are unable to benefit from having this information. There's lots of research being done to find better ways to diagnose dementia. For example, using computers to interpret brain scans more accurately, developing tests of thinking that are fairer to people who don't speak English as a first language, and using new blood tests that could replace lumbar punctures and PET scans. Taking part in this type of research will help to reduce the current unfairness in getting a dementia diagnosis, both now and for future generations.